Welcome to the NHA Phlebotomy Exam Study Guide, your path to NHA certification. Whether you're just starting your journey in phlebotomy, looking to sharpen your skills, or preparing for your NHA certification, this is the perfect place to start. In this video, we'll cover all the essentials of phlebotomy, including best practices, practical techniques, and exam tips to ensure you're fully prepared. After each chapter, we've included a Q&A section to help solidify your understanding. For the ultimate prep experience, check the description to access the Audible version, the free exam prep guide, or the Amazon link for the book. Don't forget to like and subscribe for more exam resources and updates. Now, here's your instructor to guide you on this path to certification.
Number 1. Which finger is generally preferred for a capillary puncture? A. Index finger, B. Middle finger, C. Ring finger, or D. Thumb? The answer is B. Middle finger. Number 2. What is the maximum depth for a heel stick on an infant during capillary puncture? A. 1.0 millimeters, B. 2.0 millimeters, C. 3.0 millimeters, or D. 4.0 millimeters. The answer is B. 2.0 millimeters. Number 3. Which pieces of equipment are specifically designed for collecting capillary blood samples? A. Evacuated tube, B. Microcontainer, C. Syringe, or D. Adapter? The answer is B. Microcontainer. Number 4. What is a crucial step to ensure adequate blood flow during capillary puncture? A. Applying a tourniquet tightly, B. Warming the puncture site, C. Using a larger lancet, or D. Massaging the area vigorously? The answer is B. Warming the puncture site. Number 5. Which of the following is a common complication associated with capillary puncture? A. Hemolysis, B. Thrombosis, C. Infection, or D. All of the above? The answer is A. Hemolysis. Number 6. Which layer of skin is punctured during a capillary puncture? A. Epidermis, B. Dermis, C. Hypodermis, or D. Subcutaneous? The answer is A. Epidermis. Number 7. Which of the following tests typically require a venous sample instead of a capillary sample? A. CBC, complete blood count, B. Blood gases, C. Blood glucose, or D. Hemoglobin A1C? The answer is B. Blood gases. Number 8. Which age group is capillary puncture most commonly used on? A. Infants, B. Children, C. Adults, or D. Elderly? The answer is A. Infants. Number 9. How should the finger be positioned before a capillary puncture? A. Upright, B. Downward, C. Sideways, or D. Any direction is acceptable? The answer is B. Downward. Number 10. Why should the first drop of blood after a capillary puncture be wiped away? A. It is too large for the test, B. It might be contaminated with tissue fluid, C. It helps stimulate blood flow, or D. All of the above? The answer is B. It might be contaminated with tissue fluid. Number 11. Which part of the heel is recommended for a capillary puncture in adults? A. Center, B. Side, C. Top, or D. Bottom? The answer is B. Side. Number 12. Capillary blood is a mixture of arterial and which other type of blood? A. Venous, B. Plasma, C. Interstitial, or D. lymphatic? The answer is A, venous. Number 13. Which finger is typically avoided during a capillary puncture? A, index finger, B, middle finger, C, ring finger, or D, thumb? The answer is D, thumb. Number 14. For what main reason might a capillary puncture be chosen over a venipuncture in adults? A, the patient has difficult veins, B, it's faster, C, it's cheaper, or D, it's more accurate. The answer is A, the patient has difficult veins. Number 15. After how many unsuccessful attempts should another phlebotomist be consulted? A, 1, B, 2, C, 3, or D, 4? The answer is B, 2. Number 16. Which antiseptic is most commonly used before a capillary puncture? A, iodine, B, hydrogen peroxide, C, isopropyl alcohol, or D, chlorhexidine? The answer is C, isopropyl alcohol. Number 17. How long should pressure be applied after capillary puncture to prevent bruising? A, 1 to 2 minutes, B, 2 to 3 minutes, C, 3 to 4 minutes, or D, 4 to 5 minutes? The answer is A, 1 to 2 minutes. Number 18. Which is not a common site for capillary puncture in adults? A, tip of the finger, B, earlobe, C, heel, D, forearm? The answer is C, heel. Number 19. Why should excessive milking of the finger be avoided during capillary puncture? A, it can cause pain, B, it can dilute the sample with tissue fluid, C, it can lead to hemolysis, D, both A and B? The answer is D, both A and B. It can cause pain or it can lead to hemolysis. Number 20. Capillary samples are commonly used for which of the following tests? A, blood culture, B, coagulation tests, C, blood glucose monitoring, or D, lipid profile? The answer is C, blood glucose monitoring. Number 21. What is the main disadvantage of using capillary blood over venous blood? A, slower collection time, B, limited volume, C, more painful, or D, less accurate results? The answer is B, limited volume. Number 22. What should be done if a patient shows sign of fainting during a capillary puncture? A, continue the procedure quickly, B, lay the patient down and elevate their legs, C, ask the patient to stand up and walk around, or D, ignore the symptoms and carry on? The answer is B, lay the patient down and elevate their legs. Number 23. Which of the following can impact the quality of a capillary blood sample? A, dehydration, B, poor circulation, C, edema, or D, all of the above? The answer is D, all of the above. Number 24. What is the recommended angle for a lancet during a capillary puncture? A, 90 degrees, B, 60 degrees, C, 45 degrees, or D, 30 degrees? The answer is C, 45 degrees. Number 25. Which blood component might be higher in capillary blood than in venous blood? A, platelets, B, white blood cells, C, glucose, or D, hemoglobin? The answer is C, glucose. Number 26. Why should a capillary puncture site never be punctured twice? A, it can cause infection, B, it will not yield any blood, C, it can cause tissue damage, or D, all of the above? The answer is D, all of the above. Number 27. If the puncture site is swollen, edematous, the sample may be A, contaminated with interstitial fluid, B, richer in red blood cells, C, more accurate, D, of a darker color. The answer is A, contaminated with interstitial fluid. Number 28. A capillary puncture should be done below or above which of the following? A, previous puncture site, B, an IV line, C, a tattoo, or D, a scar. The answer is B, an IV line. Number 29. What is the primary purpose of warming the puncture site before capillary collection? A, to soothe the patient, B, to sterilize the site, C, to increase blood flow, or D, to numb the area. The answer is C, to increase blood flow. Number 30. How long should the puncture site be cleaned and allowed to air dry before performing a capillary puncture? A, 15 seconds, B, 30 seconds, C, 45 seconds, or D, 60 seconds. The answer is B, 30 seconds. Number 31. Which device pierces the skin in a capillary puncture? A, needle, B, syringe, C, lancet, or D, scalpel. The answer is C, lancet. Number 32. Which of the following might indicate a poorly done capillary puncture? A, bright red blood, B, blood that flows freely, C, blood that appears to ooze or seep out, D, blood that fills the microcontainer quickly. The answer is C, blood that appears to ooze or seep out. Number 33. In which patient is capillary puncture not typically recommended? A, those with severe hydration, B, those with good hydration, C, those who are calm, or D, those with prominent finger veins. The answer is A, those with severe dehydration. Number 34. When collecting multiple capillary tubes, which tube should be collected first? A, EDTA tube, B, heparin tube, C, serum separator tube, or D, sodium citrate tube. The answer is A, EDTA. Number 35. Capillary puncture is most commonly used in elderly patients who A, have good vein visibility, B, are well hydrated, C, have thin fragile veins, or D, have no preference over venipuncture. The answer is C, have thin fragile veins. Number 36. What is a suitable alternative site for capillary puncture if the fingers are not viable? A, wrist, B, elbow, C, earlobe, or D, ankle. The answer is C, earlobe. Number 37. A, those requiring large volumes of blood, B, those with easy-to-find veins, C, those needing frequent blood monitoring, or D, those who prefer venipuncture. The answer is C, those needing frequent blood monitoring. Number 38. Which of the following must be checked before performing a capillary puncture? A, patient's diet, B, time of the last meal, C, patient's identification, or D, patient's job. The answer is C, patient's identification. Number 39. How should the collected capillary tubes be stored before analysis? A, in a standing position, B, horizontally, C, any position is fine, or D, upside down. The answer is B, horizontally. Number 40. What should be avoided when choosing a site for capillary puncture? A, scarred areas, B, swollen areas, C, areas near a tattoo, or D, all of the above? The answer is D, all of the above. Number 41. In what order should blood drops be collected for different tests during a capillary puncture? A. Coagulation tests, chemistry tests, hematology tests. B. Hematology tests, coagulation tests, or chemistry tests. Number C. Chemistry tests, hemoglobin tests, coagulation tests. Or D. Hematology tests, chemistry tests, coagulation tests. The answer is D. Hematology tests, chemistry tests, coagulation tests. What is the most critical factor in obtaining a reliable capillary blood specimen? A. Speed of collection. B. Volume of the blood. C. Site preparation. Or D. Type of lancet used. The answer is C. Site preparation. Number 43. Which of the following actions can minimize pain during a capillary puncture? A. Using a dull lancet. B. Puncturing quickly and firmly. C. Choosing a thick part of the finger. Or D. Puncturing the center of the fingertip. The answer is B. Puncturing quickly and firmly. Number 44. Capillary puncture is particularly useful when the patient has A. Clotted veins, B. Thick skin, C. Good hydration, or D. Varicose veins. The answer is A. Clotted veins. Number 45. Which of the following could lead to contamination of the capillary specimen? A. Using alcohol and allowing it to dry completely. B. Using iodine as a disinfectant. C. Not allowing the disinfectant to dry completely. Or D. Cleaning the site thoroughly. The answer is C. Not allowing the disinfectant to dry completely. Number 46. What is essential to do before performing a capillary puncture? A. Ensure the patient is sitting comfortably. B. Verify the patient's identity. C. Choose the puncture site. Or D. All of the above. The answer is D. All of the above. What can happen if the puncture is too deep during a heel stick? A. Inadequate sample. B. Bone damage. C. Excessive bleeding. Or D. Rapid healing. The answer is B. Bone damage. Number 48. Which condition can lead to altered capillary puncture results? A. Polycythemia. B. Anemia. C. Dehydration. Or D. All of the above. The answer is D. All of the above. Number 49. When should the tourniquet be released in a capillary puncture procedure? A. Before the puncture. B. Immediately after the puncture. C. 1 minute after the puncture. Or D. Tourniquets are not used in capillary punctures. The answer is D. Tourniquets are not used in capillary punctures. Number 50. Which factor is essential for choosing the puncture site in a capillary collection? A. Ease of access. B. Visibility of veins. C. Skin thickness. Or D. Patient comfort. The answer is A. Ease of access. Number 51. How should the lancet be disposed of after a capillary puncture? A. In the regular trash. B. In a sharps container. C. In a biohazard bag. Or D. In a recycling bin. The answer is B. In a sharps container. Number 52. What is an essential safety measure during capillary punctures? A. Wearing gloves. B. Using a new lancet for each patient. C. Disposing of lancets properly. Or D. All of the above. The answer is D. All of the above. Number 53. Which device is used to mix capillary blood collected in tubes? A. Mechanical mixer. B. Gentle shaking by hand. C. Inverting the tube several times. Or D. A vortex mixer. The answer is C. Inverting the tube several times. Number 54. What would be the consequence of a shallow puncture during a capillary collection? A. Excessive bleeding. B. Inadequate blood flow. C. Faster clotting. Or D. Increased risk of infection. The answer is B. Inadequate blood flow. Number 55. What consideration is crucial when selecting the gauge of the lancet in capillary puncture? A. The patient's age. B. The volume of blood needed. C. The thickness of the skin. Or D. All of the above. The answer is D. All of the above. Number 56. How does capillary blood collection generally affect patients compared to venipuncture? A. It is more painful. B. It is less stressful. C. It takes longer. Or D. It is more likely to cause bruising. The answer is B. It is less stressful. Number 57. What precautions should be taken when performing capillary puncture on a patient with a blood disorder? A. Use a smaller lancet. B. Puncture a site far from a joint. C. Apply prolonged pressure to the puncture site. Or D. Avoid the procedure if possible. The answer is C. Apply prolonged pressure to the puncture site. Number 58. What should be done if a hematoma starts forming during a capillary puncture? A. Continue the procedure quickly. B. Apply pressure and elevate the site. C. Discontinue the puncture immediately. Or D. Try puncturing a nearby site. The answer is C. Discontinue the puncture immediately. Number 59. What is the correct order of blood draw in a multi-sample capillary collection? A. EDTA tubes, serum tubes, heparin tubes. B. Heparin tubes, EDTA tubes, serum tubes. C. Serum tubes, heparin tubes, EDTA tubes. D. None of the above. The answer is A. EDTA tubes, serum tubes, heparin tubes. Number 60. Why is it important to fill the capillary tubes promptly after puncture? A. To prevent clotting. B. To avoid hemolysis. C. To ensure adequate sample volume. Or D. All of the above. The answer is D. Number 61. How should the capillary puncture site be chosen for individuals with burns or scars? A. Avoid the affected areas. B. Puncture the least affected area. C. Puncture near the burned or scarred area. D. Choice of site doesn't matter. The answer is A. Avoid the affected area. Number 62. When is it appropriate to perform a capillary puncture on the tip of the finger? A. In adults. B. In infants. C. In elderly patients. Or D. Never. The answer is D. Never. Number 63. Which of the following patients is most suitable for capillary blood collection? A. A dehydrated patient. B. A patient with edematous hands. C. A patient with thrombosed veins. Or D. A patient with good venous access. The answer is C. A patient with thrombosed veins. Number 64. What should be prioritized in choosing a capillary puncture site? A. Convenience of the phlebotomist. B. Absence of pain for the patient. C. Proximity to other puncture sites. Or D. Visibility of the arteries. The answer is B. Absence of pain for the patient. Number 65. In which patients is the earlobe a suitable site for capillary puncture? A. Infants, B. Adults, C. Elderly, or D. Teenagers? The answer is B. Adults. Number 66. Which of the following can cause contamination of the capillary puncture site? A. Touching the site after disinfection, B. Using expired disinfectants, C. Not allowing the disinfectant to dry, or D. All of the above? The answer is D. All of the above. Number 67. Which precaution is essential to avoid squeezing or milking the puncture site excessively? A. To prevent hemolysis, B. To avoid altering test results, C. To minimize patient discomfort, or D. All of the above? The answer is D. All of the above. Number 68. What is the importance of warming the puncture site before the procedure? A. To reduce patient discomfort, B. To increase blood flow, C. To sterilize the site, or D. To make the veins more visible? The answer is B. To increase blood flow. Number 69. When should a new capillary tube be used during blood collection? A. When the tube is not filling, B. When the blood flow stops, C. When the tube appears cracked, or D. All of the above? The answer is D. All of the above. Number 70. Which situation requires the postponement of a capillary puncture? A. When the patient is well hydrated, when the patient is calm, C. When the patient is experiencing hyperventilation, or D. When the patient's pulse is steady? The answer is C. When the patient is experiencing hyperventilation. Which antiseptic is commonly used for cleaning the puncture site in a routine capillary puncture? A. Iodine, B. Hydrogen peroxide, C. Isopropyl alcohol, or D. Chlorhexidine? The answer is C. Isopropyl alcohol. Which of the following is a reason to avoid the use of fingertips for capillary blood collection in adults? A. Excessive callousing, B. Improved blood flow, C. Easy accessibility, or D. Lower pain sensitivity? The answer is A. Excessive callousing. Number 73. Which complication may arise due to excessive milking of the puncture site? A. Hemolysis, B. Hematoma, C. Scar formation, or D. Thrombosis? The answer is A. Hemolysis. Number 74. What should be done with the first drop of blood in a capillary puncture? A. Discarded, B. Collected for testing, C. Used for smear preparation, or D. Analyzed separately? The answer is A. Discarded. Number 75. What is a critical consideration when choosing the lancet size for neonates? A. The depth of puncture, B. The sharpness of the lancet, C. The type of test, or D. Volume of blood required? The answer is A. The depth of the puncture. Which technique helps in enhancing the blood flow in the chosen puncture site? A. Cooling the site, B. Massaging the site, C. Warming the site, or D. Elevating the site? The answer is C. Warming the site. Number 77. Which finger is generally recommended for capillary blood collection in adults? A. Index finger, B. Middle finger, C. Ring finger, or D. Pinky finger? The answer is B. Middle finger. Number 78. How many times can the same capillary puncture site be punctured consecutively? A. Once, B. Twice, C. Thrice, or D. 4 times? The answer is A. once. Number 79. Which of the following could lead to a diluted blood specimen in a capillary puncture? A. Excessive squeezing of the puncture site. B. Too deep a puncture. C. Incorrect angle of puncture. Or D. Using an incorrect size of the lancet. The answer is A. Excessive squeezing of the puncture site. Number 80. Which of the following sites is typically used for capillary blood collection in neonates? A. Toe. B. Finger. C. Heel. Or D. Earlobe. The answer is C. Heel. Number 81. How should the puncture site be held during blood collection in a capillary puncture procedure? A. Firm pressure should be applied. B. It should be massaged gently. C. It should be held downward. Or D. It should be elevated above the heart. The answer is C. It should be held downwards. Number 82. What should be the maximum depth of a heel stick puncture in a neonate? A. 1.0 millimeters. B. 2.0 millimeters. C. 3.0 millimeters. Or D. 4.0 millimeters. The answer is B. 2.0 millimeters. Number 83. Which of the following indicates a suitable capillary puncture site? A. Swollen area. B. Scarred tissue. C. Area near a previous puncture. Or D. Warm, pink, free of lesions. The answer is D. Warm, pink, and free of lesions. Number 84. When is the use of a heel stick for capillary puncture most appropriate? A. In toddlers. B. In teenagers. C. In adults. Or D. In newborns. The answer is D. In newborns. Number 85. Which is the possible complication of a poorly done capillary puncture? A. Infection. B. Hemolysis. C. Hematoma formation. Or D. All of the above. The answer is D. All of the above. Number 86. Which action helps in preventing the contamination of a capillary blood sample? A. Wiping away the first drop of blood. B. Squeezing the puncture site. C. Applying alcohol just before the puncture. Or D. Massaging the puncture site. The answer is A. Wiping away the first drop of blood. Number 87. What should be avoided when making a skin puncture for capillary blood collection? A. Puncturing perpendicular to the fingerprint lines. B. Puncturing the central part of the fingertip. C. Puncturing along the fingerprint lines. Or D. Choosing a well-perfused site. The answer is C. Puncturing along the fingerprint lines. Number 88. How is capillary blood sampling advantageous over venous blood sampling? A. It allows for a larger sample volume. B. It is less prone to contamination. C. It is usually less painful. And D. It is suitable for all types of tests. The answer is C. It is usually less painful. Number 89. Which of the following can affect the accuracy of results obtained from capillary blood samples? A. Altitude. B. Patient's posture. C. Time of collection. Or D. All of the above. The answer is D. All of the above. Number 90. When performing a heel stick on an infant, where should the puncture be made? A. Anywhere on the heel. B. On the most protruding part of the heel. C. On the medial or lateral plantar surface. Or D. On the back of the heel. The answer is C. On the medial or lateral plantar surface. Number 91. What is a precaution to take when performing a capillary puncture on a patient with coagulation abnormalities? A. Puncture more deeply than usual. B. Avoid the procedure. C. Ensure proper hemostasis after the procedure. Or D. use a larger lancet? The answer is C. Ensure proper hemostasis after the procedure. Number 92. Which procedure is typically followed when performing capillary punction for glucose monitoring? A. Heel stick. B. Earlobe puncture. C. Finger stick. Or D. Toe puncture. The answer is C. Finger stick. Number 93. Why should the puncture site not be over-squeezed during capillary blood collection? A. It can cause unnecessary pain. B. It can cause hemolysis. C. It can dilute the sample with tissue fluid. D. B and C. The answer is D. It can cause hemolysis and it can dilute the sample with tissue fluid. Number 94. What consideration should be given to the patient's hand position during a finger stick? A. The hand should be elevated. B. The hand should be held at heart level. C. The hand should be positioned downward. And D. The hand position is not significant. The answer is C. The hand should be positioned downward. Number 95. Which factor could lead to insufficient blood flow during capillary puncture? A. Too shallow puncture. B. Cold temperature at the puncture site. C. Using a large lancet. Or D. A and B. The answer is D. Too shallow a puncture, and B. Cold temperature at the puncture site. Number 96. Which information is necessary to verify before performing capillary puncture? A. Patient's dietary habits. B. Time of the last meal. C. Patient's identity. Or D. All of the above. The answer is C. Patient's identity. Number 97. Which order of draw is recommended when collecting multiple samples during capillary puncture? A. EDTA tubes, heparin tubes, other additive tubes, serum tubes. B. Serum tubes, heparin tubes, EDTA tubes, other additive tubes. C. Heparin tubes, EDTA tubes, serum tubes, other additive tubes. D. There is no specific order recommended. The answer is A. EDTA tubes, heparin tubes, other additive tubes, and serum tubes. Number 98. What is a common mistake that could lead to erroneous results in a capillary blood gas analysis? A. Collection into a heparinized tube. B. Excessive milking of the finger. C. Air bubbles in the collected sample. Or D. Using an alcohol swab for cleaning the puncture site. The answer is C. Air bubbles in the collected sample. Number 99. What precautions should be taken when puncturing the heel of infants? A. Avoid puncturing too deep to prevent injury to the calcaneus. B. Ensure the puncture is deep for adequate blood flow. C. Puncture the central part of the heel for maximum blood flow. D. Use the same puncture site for repeated collections. The answer is A. Avoid puncturing too deep to prevent injury to the calcaneus. Number 100. Which of the following is crucial in ensuring the reliability of test results in capillary blood collections? A. Speed of the collection process. B. Size of the lancet used. C. Proper mixing of additives with the collected blood. And D. Choice of puncture site. The answer is C. Proper mixing of additives with the collected blood. 101. What should be done if the blood flow stops prematurely during a capillary puncture? A. Apply more pressure to the site. B. Milk the site more vigorously. C. Perform the puncture at a different site. Or D. Use a larger lancet for a deeper puncture. The answer is C. Perform the puncture at a different site. Number 102. Which of the following is a consideration when choosing a capillary puncture site? A. The site should be easy to squeeze. B. The site should be heavily calloused for easier puncture. C. The site should be free of any visible veins. D. The site should be warm and well perfused. The answer is D. The site should be warm and well perfused. Number 103. Which of the following guidelines should be followed for capillary puncture in infants? A. Puncture should be as deep as possible. B. Any part of the heel can be punctured. C. A fresh puncture site should be chosen for repeated collections. And D. The same site can be reused if the punctures are not frequent. The answer is C. A fresh puncture site should be chosen for repeated collections. 104. When should the tourniquet be applied in a capillary blood collection procedure? A. Before choosing the puncture site. B. After cleaning the puncture site. C. Tourniquets are not used in capillary puncture. Or D. Immediately before the puncture. The answer is C. Tourniquets are not used in capillary puncture. Number 105. Which of the following statements is true regarding the collection of capillary blood samples? A. They require larger volumes compared to venous samples. B. They are collected in larger tubes compared to venous samples. C. They are generally used for hematological and blood gases. And D. They should be collected in a fasted state only. The answer is C. 106. Which of the following precautions helps prevent injury and infection during a capillary puncture procedure? A. Reusing lancets after proper sterilization. B. Discarding lancets in a sharps container. C. Performing the puncture quickly without assessing the site. And D. Applying strong pressure to the puncture site immediately after the procedure. The answer is B. Discarding lancets in a sharps container. Number 107. Which of the following considerations is necessary for accurate glucose monitoring using capillary blood? A. The patient's hydration status. B. The size of the lancet used. C. The timing of blood collection. And D. The altitude of collection site. The answer is A. The patient's hydration status. Number 108. Which of the following statements is true regarding the healing of the capillary puncture sites? A. Heel sticks heal slower than finger sticks. B. Finger sticks heal slower than heel sticks. C. Both sites heal at the same rate. And D. Healing rate is dependent on the individual's health status. The answer is A. Heel sticks heal slower than finger sticks. Number 109. What is the disadvantage of capillary blood sampling compared to venous blood sampling? A. Capillary sampling is more painful. B. It provides a smaller volume of blood. C. It is more prone to contamination. And D. It is less suitable for multiple tests. The answer is B. It provides a smaller volume of blood. Number 110. What is a crucial aspect to ensure the reliability and accuracy of point-of-care testing, POCT, using capillary blood? A. The volume of blood collected. B. The choice of the puncture site. Or C. Quality control and calibration of the POCT devices. And D. The speed of the collection process. The answer is C. Quality control and calibration of the POCT devices. Number 111. Which of the following is the correct sequence of steps in a capillary puncture? A. Cleanse the site, puncture the skin, collect the blood, apply pressure. B. Puncture the skin, cleanse the site, collect the blood, apply pressure. C. Puncture the skin, collect the blood, cleanse the site, apply pressure. And D. Collect the blood, cleanse the site, puncture the skin, and apply pressure. The answer is A. Cleanse the site, puncture the skin, collect the blood, apply pressure. Number 112. Which of the following factors does not impact the quality of a capillary blood sample? A. The cleanliness of the puncture site. B. The size of the puncture. C. The type of collection device used. And D. The time of day the sample is collected. The answer is D. The time of day the sample is collected. Number 113. What is a common mistake during the capillary puncture that can lead to inaccurate potassium levels? A. Puncturing too deeply. B. Excessive milking of the site. C. Choosing an inappropriate site for puncture. Or D. Inadequate mixing of the sample. The answer is B. Excessive milking of the site. Number 114. Which of the following consideration ensures the comfort and safety of the patient during a capillary puncture procedure? A. Performing the procedure as quickly as possible. B. Ensuring the puncture is deep enough for adequate blood flow. C. Properly explaining the procedure to the patient beforehand. And D. Choosing the most convenient site for puncture. The answer is C. Properly explaining the procedure to the patient beforehand. Number 115. How is the order of draw different in capillary puncture compared to venipuncture? A. The order is reversed in capillary puncture. B. There is no order in capillary puncture. C. Blood gas tubes are collected last in capillary puncture. Or D. EDTA tubes are collected first in a capillary puncture. The answer is D. EDTA tubes are collected first in capillary puncture. Number 116. Which of the following helps in enhancing blood flow in the chosen capillary puncture site? A. Applying a warm compress. B. Tapping the site gently. C. Keeping the extremity at heart level. And D. All of the above. The answer is D. Applying a warm compress, tapping the site gently, and keeping the extremity at heart level. Number 117. Which part of the finger is recommended for capillary blood collection in adults? A. Tip of the finger. B. Side of the fingertip. C. Middle of the fingertip. And D. Base of the finger. The answer is B. Side of the fingertip. Number 118. How should the finger be positioned during a capillary puncture? A. Pointing downward to facilitate blood flow. B. At heart level to ensure steady blood flow. C. Pointing upward to minimize pain. And D. Held firmly against a hard surface. The answer is A. Pointing downward to facilitate blood flow. Number 119. What should be done if a patient has cold hands before a capillary puncture? A. Proceed with a puncture as cold hands will not affect the results. B. Warm the hands by rubbing them together. C. Ask the patient to soak their hands in warm water. Or D. Use a warm compress to warm up the puncture site. The answer is D. Number 120. What is the maximum depth recommended for a heel stick puncture in newborns? A. 1.0 millimeters. B. 2.0 millimeters. C. 3.0 millimeters. Or D. 4.0 millimeters. The answer is B. 2.0 millimeters.